Anyone with bad vision knows how frustrating it can be when you can't find your glasses or you aren't wearing your contacts. Activities like watching TV, driving a car, or going for a swim can be a challenge, to say the least. Our next guest has helped thousands of people correct their vision problems through laser procedures, including LASIK, PRK, and Epi-LASIK. Dr. Jeffrey Gold is a board-certified and award-winning ophthalmologist and the owner of Liberty Vision in Hamden. Welcome back, Dr. Gold.
Thanks for having me back.
First, let's talk about LASIK in general. What does the procedure entail?
LASIK stands for laser-assisted in situ keratomileusis. I'll show you with a model.
Okay.
In LASIK, we cut the cornea, fold back a flap, change the shape of this part of the cornea, put the flap back down, the edge seals overnight, but here's why I don't do LASIK anymore. Because from here to here, it was found in a documented study in 2011 that never heals. So 20 years from now, playing volleyball in your backyard, get poked in the eye, that comes loose. If you can't find me in an hour, and I don't know where I'm going to be in 20 years, but you can't get that fixed in an hour, you're in big trouble.
So you say you don't use LASIK anymore. What do you use?
I now use Epi-LASIK.
Epi-LASIK.
Right.
And you have, well, let's show everybody the animation for this.
Okay.
And Epi-LASIK is used for?
In Epi-LASIK, just the surface layer of cells called epithelium are removed. That's why it's called Epi-LASIK,
okay.
EPI. Those are removed, and then we use the custom feature of the laser to reshape the cornea according to its own irregularities with the laser. And those cells grow back over the course of the next 3 days, and the vision is restored without the risk of having your cornea cut, either by a scalpel or by a laser. You've heard of bladeless LASIK?
Yes.
Your cornea is still being cut. So I prefer, and for the last year I have exclusively done Epi-LASIK. And over the course of the last year, 82% of my patients have 20/20 or better vision. 100% of my patients are legal for driving with Epi-LASIK.
And who is a good candidate for Epi-LASIK?
Anybody who wants to have laser vision correction who does not have one of two different corneal degenerations, which we determine with some of our screening tools, is a candidate for Epi-LASIK.
Now, there are risks involved anytime you have this type of surgery. What are they?
Anytime eye surgery is performed, there's a risk of infection, which can cause permanent loss of vision. I've done well over 20,000 eye surgeries without any infections. So if the doctor prepares the patient properly to begin with, infection is, although it's a risk, it really doesn't happen very often.
And this is a procedure that really doesn't take very long. This is what, maybe 5 minutes?
Epi-LASIK takes me 4 minutes.
4 minutes. And a lot of people are concerned about that because they're not really sure how the procedure goes, but it's painless, isn't it?
There's no pain involved. As a matter of fact, I tell my patients immediately following the procedure, pain is not allowed. So if you have any, something's wrong, you must call me immediately, day or night.
Wow. And what else do you do for eyes there other than Epi-LASIK? What else do you provide?
Well, one of the things that I love to do more than anything is monovision. And I do that with the Epi-LASIK procedure. And that's for people who are already in reading glasses or bifocals who don't want to have to wear reading glasses anymore after the procedure. We can correct the dominant eye for distance, the non-dominant eye for close, and they're done with glasses.
And they don't have to use reading glasses anymore. They don't have to worry about where those reading glasses are.
That's the beauty.
Now, you know, I've been fortunate. I have farsighted in one eye and nearsighted in the other, and I haven't had to use those reading glasses.
You're one of the lucky ones. I find myself in that situation as well, but I've had cataract surgery because I'm a little older, and I had monovision created with my cataract surgery, and it's terrific. No reading glasses. Nothing hanging around my neck or in my pocket or on top of my head. It's wonderful. Can
we go back to the Epi-LASIK? The Epi-LASIK, sure. Is that a procedure you have to do again over the years, or is it just a one-time procedure?
In my practice, 1.4% of procedures have to have a fine-tuning at some point later on, either a few months or a few years later.
What does that mean when you say fine-tuning?
We repeat the procedure and get the vision beefed up to where it's supposed to be. There can be an undercorrection or an overcorrection at the time of the original procedure, or there can be a little regression with the passage of time.
So that's why you would need the fine-tuning?
Yeah, but the odds are very, very small.
Also the cost. People are always wondering, can I afford this? I understand that many centers do offer some sort of a payment plan.
We have a payment plan through Chase Health Advance where they will finance 100% of your procedure and give you a year to pay it back interest-free.
So it makes it a lot easier for people to be able to afford something like this.
It really makes it affordable.
Now when it comes to vision, everybody should see their ophthalmologist how many times a year?
Depends on your age.
Okay.
Anybody over 35 should see the ophthalmologist once a year.
Once a year.
Between the ages of 20 and 35, it can be every 2 years, assuming there are no issues, if it's just a healthy follow-up exam.
And then older, let's say 50 and older, is there a cutoff point for the older?
It's still once a year.
It's still once a year.
Right.
Unless you have issues.
Right.
All right, and of course, you've got to go to an ophthalmologist certified board ophthalmologist.
Exactly.
Dr. Gold, it's always great to have you with us.
Thank you.
Thanks so much for being here.
Thank you.